who can do this. Otherwise, one patient from Calcutta underwent a hair transplantation. I did transplantation in this area. That fellow, once he finished off the surgery, he discontinued all the tablets. He had hair throughout the scalp except this temporal area. I did a single hair graft over there. Now, after 2 years, he has come to me with only the hair which I have done, all other hair has gone. I can catch hold of that fellow with the hair which I have implanted now. It is something like a horn. So, ask him whether he will continue. If not, don't go in for a surgery. You will spoil your name. Once we start to spoil, one patient from one area spoils your name, one street is gone. 10 patients spoil your name, one city is gone. Go to another city. Then practice there, again start your practice from there, 1, 2, 3, 4. Again you end up with problems. So, be careful. See whether he will be regular or not. 1. 2, greediness. People, these hair transplantation people, they are too much greedy. They think that they can get hair like anybody other common man. That's not at all feasible. We are not God to create a hairline which is normally present in a normal human being. Right? We can maybe around 30 to 40% of normal density only we can give. I do in and around 800 to 900 grafts per sitting. I do motor hair transplantation, single hair transplantation, and sometimes strips which I have designed. It's a high bleeding surgery. Instead of taking grafts from a strip, you take a strip from the back, same way you do a cut over here in the front, and they put the strip inside it. You need not go in for a single haircut, nothing. Just put that worm inside and put a small stay suture. This will give tremendous result. The only thing, there will be a big amount of bleeding. And there will be a small hair scar there, a small line. But the results will be very good. This we have done in around 30 to 40 patients. Say a hairline, see this is a man, this is a man. You want to have a hairline, you go on transplant. For that purpose what you can do is, you put a small strip, you put a small tunnel here, you take a small strip from here, put the whole strip in it. It will be something like a cord, just place it inside, everything will be good. This we are trying now and the results are so good. 1. Second one, punch grafting. Punch grafting is for only vertex areas. Punch grafting to frontal and temporal areas will leave out scars, will look odd. Earlier we used to do that, but now we go in for single hair grafting. The next one will be artificial hair grafts. Artificial hair graft is a plastic hair, as you know. It's very, very simple. The only thing, you have to go in for a pre-assessment. Assessment in the sense, you have to see that it does not go in for an allergy. I had ended with 2 cases of this allergy. Plastic hairs I implanted. I should have implanted around 300 hairs. Now only 2 hairs are remaining. All other hairs have fallen out, leaving out granuloma. So the allergic reaction, that we have to be very, very careful in going in for any artificial hair. But it's very, very simple. I think you are able to see me. This is an artificial thing. See that needle? The needle has a small notch at the front. Small notch at the front. Right? Same way these hairs, these are the artificial hairs. See that? It has small holes in the front. Yeah. See that? I think you are able to see that knot. So put your needle into the knot. Put your needle into the knot and insert it inside. So you see, this is how we transplant. See, this is an artificial transplant. Put the needle into it. Put the nail inside. Just close it. Put that. See that? It's so simple. We can implant around 300 to 400 hairs per sitting. See that? What I am doing is, see, just watch carefully. See, I am just putting that knot, inserting the inside the knot, and just putting it and just withdrawing it. Why I withdraw it is, this knot has to go inside the skin and it tightens, we remove that needle. So I just insert it, that's it. Simple that. It's something like a weaving phenomenon, so simple. The only thing, the reaction, and this hair will last for maybe 3 to 4 years only. This is not going to be permanent. This is not going to be permanent, very, very costly. One hair is 100 rupees. Right, one hair, actually they give it for 28 rupees. I charge around 100 rupees. I am a very costly surgeon, costliest surgeon as such. Right, I charge 100 rupees. If I am going to do 400 roots, it will cost around 40,000 rupees. So this is little bit costly. Otherwise, this is a nice technique. The only thing, what I advise you people is, before going for a full hair graft, full artificial hair graft, to 2 or 3 grafts, see whether you develop any allergy and then go in for transplant. If at all there is allergy, don't start that. So tell them that we are going to do an allergic test with the hair, implant 2-3 hairs. If at all there is a reaction, how come you can judge that? There can be a small vesiculation, there can be burning sensation. Plug the hair, just remove it like that. Within a week, if you can remove it, the allergy reaction will start within 2-3 days. Within a week, if you can remove it, it's good. After 1 week, you can't even remove it. Then it becomes tedious. So this is a very simple procedure. Do an allergic test, then go in for a full graft. Now I will show you some punch grafting and single hair grafting. Just trim the hair where you are going to remove. Just trim it. Yes, I am going to take the hair from that area. And now the single hair graft has become very, very simple. Earlier the single graft we have to go in for. Now you see, this is a punch. This is a punch, right? Metal punches. This is a single hair punch. See this? This is a single hair punch. So you need not even go in for removal of a strip. Cut that and again go in for a transplant, which takes more time. Anyway, for a demonstration's sake, I will do it. But for you, if you have these things, this set costs around 2,000 rupees only. Right? So if you can remove this like a punch biopsy, do this, take it implant, do it, implant, do it, implant, do it, implant. This will be also easy. I will demonstrate all 3 techniques now. So we are just harvesting. The harvesting thing, you have to be very careful in that angle. Angle is, you see the back hair, normally when you remove, you have to remove it this way, because you go parallel to the hair root. You go, if you are going to go the other way, it's going to get cut. So go to the left side of the patient, go parallel to the hair root. Left side of the patient, go parallel. And implanting also, you are going this way, implanting, you are coming this way. Otherwise, you see this way head. If I am going to do a hair transplantation here, I am going to take the harvesting the hair. This angle should be this way. Cutting should be this way. Whether it is single hair or punch graft, this should be this way. The hair is growing like that. When you implant, see the hair here is growing this way and turning. So you transplant this way. Right? So this is the only thing which we have to be careful. Otherwise, something like a porcupine, everything will stand up like that. So this is the only one which we have to be careful. Otherwise, the results are tremendous here. This is a motor punch. We can go up to in and around 80 to 90 grafts. One 4 mm punch. This is a 4 mm punch.